Hi, okay, so today we're going to be talking about specimen management and how we handle putting them into containers and shipping them off to wherever they need to go. So first off, we start off with our lab forms. As you see here, we have three companies that we go through. We go through IDEX, Abaxis, and Antec, and I filled out the Antec one. As you can see, we have our client number right here, our doctor, the client's last name, and the pet. So Keely is a canine. She's a husky mix. She is spayed, and she's about 5 years old. Along with that, we have our clinic name and address. So if they need to send anything back, they have that available for us. So whenever Antec requests anything for lab work, we fill out any of this. So if Keely were to be getting a wellness today, she would be getting her PWR, or her pet wellness report, and we would check that off accordingly. Now, whenever we do her wellness or any type of blood work, we need to collect urine that will be sent out in this, her EDTA, and some serum to send out. Now, normally we just we spin down the red top tube to get some serum off and replace it. And what we will do, we will put the Antec form into our bag, and we will put our tubes accordingly what we need into the bag as well. Now, if we are doing some type of avian culture, we will put slides into our slide box and send them out also. We also have biopsy containers, large and small. And whenever we start to head out into the postal, we pack with ice, with an ice pack. We put it into the box, pack everything as tightly as possible so nothing gets jostled around. Most of the time we put our blood work out into our blood work box so the companies are able to pick it up in the afternoon. And that is also, we need to put an ice pack into the box as well if it is hot outside. And that's how we do our specimen management. Okay, so I'm going to be demonstrating an ELISA test. So this, we've already collected our sample from our patient, and that the syringe was pre-heparinized. So we have our heparinized blood, and I'm going to add 3 drops to our little test tube and 4 drops of conjugate. And close up our tube. Mix gently. And we're going to add it to our test. And the blood is going to rise. And as soon as it gets to this little hole, we're going to snap our test. Okay, as you can see, the blood is starting to come through, so I'm going to go ahead and snap it, and the solution is going to wash through and give us a either negative or positive result. Okay, as you see here, our ELISA test shows negative, so in that takes normally about 8 to 10 minutes to get this result. Hi, okay, so today we have Rowdy here, and I'm going to be getting an ear swab off of him. I'm going to break this one because it's the left ear. Lets me know which one I've done. Now I'm going to go ahead and put it on the slide. Normally do the left ear first. Then the right ear, and we make sure to roll it out. Make sure we don't get big chunks on there. We'll fix it. Now I'm going to stain it in the difficult solution. And into the last solution.
I mean, seriously, within like 2 hours. I mean, now Max still itches occasionally, but nothing like what you would.
Rinse that off as well. Dry it off with the paper. Okay. After that, I'm going to be examining the sample. I'm going to put it under a microscope. I'm going to put it under 100 power right now so I can focus onto the left side. Okay. Now that I've got a good sighting, I'm going to go ahead and put the oil immersion on. Put a drop, and then go to the oil immersion. And I'm going to focus in on my sample. And it looks like we have at least 1+ yeast on the left side. Doesn't look like there are any cocci in the sample. And so you can see, it looks like we have yeast in our sample.
Hi, I'm Dr. Robinson. This is Megan. We're going to do a necropsy on this little puppy. He's a 4-week-old male puppy. One of 2 in a litter. The other litter mate is perfectly healthy. This puppy came in yesterday severely hypothermic, dehydrated, had not been eating well for a couple days, and passed away shortly after we instituted therapy. So we have him already opened. You can see thoracic cavity, abdominal cavity. So basically we're going to start with the abdominal cavity, and I'm going to go ahead and make an incision in the diaphragm just to be able to see a little bit better. Get that out of the way. The diaphragm itself looks normal. Okay, so starting at the front, the liver looks mildly swollen. It has a little bit of brown tan discoloration, but there's no mottling, there's no signs of nodules or any sort of infection. The gallbladder is full, does not have any abnormalities grossly. The stomach is greatly dilated. We did tube feed this puppy right before he passed away, so this is likely food substances in there, but we'll check later. The intestinal tract is just generally dilated and swollen. It has evidence of some hemorrhage inside and potentially some necrosis as well. This puppy did have some bloody stool and bloody diarrhea right before passing away. Extend this incision in the musculature just a little to visualize. The left kidney looks very swollen, very edematous in the medulla and the cortex as well. Let's flip over and see if we can visualize this right kidney. See if they're both swollen. Ooh, still liver enlargement. Yes, both kidneys are dilated. You can see, Megan, if you see, there's the adrenal gland right in front of the kidney right there. the liver's just pretty swollen. So this, you know, this puppy, with fading puppy syndrome, you never know exactly what's going on. The spleen is mottled. It's not big. This is a normal size. This is a primary intestinal problem. I do believe this puppy had a history of not wanting to eat for a couple days before presentation. So, you know, you always worry about parvovirus, you worry about intestinal parasites, you worry about, you know, other hemorrhagic problems. We'll cut into the intestines here in a little bit. In the chest, now this puppy passed away yesterday. If you notice, the lungs are really hyperemic and reddened on both sides. This could be from a primary pneumonia, aspiration, could also be just from passive congestion if this puppy sat overnight on its back. All the blood will pool down at the bottom. But if you notice, they do look very mottled, so I'd be concerned that this puppy may have had some aspiration or may have had a primary pneumonia problem as well. The heart is a normal sized for this puppy, so we'll take that out and look at it. If you're going to be submitting samples, you know, for necropsy, this owner does not want anything but a gross necropsy, okay. So we're not going to be submitting samples, but if you did want to submit samples, you definitely want to take the liver, the spleen, and potentially some intestinal mucosa, especially if there's, you know, some evidence of intestinal disease, definitely some kidney, lungs, and heart. Then you submit those to a lab, and they would do some microbiology testing. You give them a history, you know, and they can figure out exactly why this puppy died. So there's urinary bladder right there. So Megan, if you want to cut into the intestines, we can see exactly what it looks like on the inside. Gotta get the omentum out of the way. There you go. I'm gonna hand that off to you. Basically just start at one end and cut it open all the way to the other. Okay. Doesn't matter really which direction you start from, we're going to open it all up anyway. Yep, that's fine. Yep, you're just going to make a little cut and then extend longitudinally. Let's see if we can see anything important in there. Some easier. I'll give you some resistance there. Yep, thank you. Perfect. And we have intestinal parasites. I think the litter mate was actually just diagnosed with roundworms, so those are probably roundworms. That very well could have been a cause of this puppy's, you know, inappetence. But yeah, they're obviously infested, so that very well could have been what instigated it. I think what killed this puppy is probably severe hypothermia, you know, and dehydration, but that definitely could contribute. So we'll go ahead and open up the stomach as well, but that could definitely account for the blood. That could definitely account for lots of stuff. So.
Hi. Okay, so as you can see, he definitely had a huge infestation of roundworms. Now I'm going to talk to you guys about doing the rabies testing. So here you can feel the spine, and normally what they do, they take off and they cut off in between the atlas and the axis so they can have good specimen. So what you're going to do, you're just going to cut right in between here and just cut all the way across and cut down in between the muscle and the skin and in between the spine and get a good clear specimen. And whenever you ship it, they ship it on ice in a small little box, just via their requirements. Okay, so today we're going to be doing a vaginal cytology. This is Miss Ruby volunteering for us.
Hi, Dr. Black.
Sandy. All right. Detail. Alright, I'm just going to roll this onto the slide. I'm going to stain it.
Oh, poor Ruby. Ruby's so quiet now.
So Ruby is not in heat. She is still nursing her puppies. So I'm not expecting to find anything, any type of in heat cells. Focus.
This was in the parking lot. Do you need anything to?
And here it looks like we're definitely seeing anywhere in between diestrous and anestrous cells. Okay, today we're going to be doing our cross-matching agglutination testing today. As you can see, I've already got both donor and recipient blood, and the serum separators are nice and clotted. So we're going to go ahead and centrifuge this down. This is just a sample. Okay. And in our centrifuge, it has a preferred 5-minute spin down. So we're going to go ahead and spin those down. Okay, so we have our serum separators all done spinning. So I'm just going to set these over here while I take the other one out. And so this is the donor, so I'm going to go ahead and separate the serum out. And I have the recipients. Okay. And then we're going to centrifuge our EDTA tubes. And it's the same settings as the serum separators. Okay, so we've centrifuged our EDTA tubes, and I'm going to go ahead and take the plasma off the top of our donor. Alright, set that down. I'm going to go ahead and place 2 drops of the washed erythrocytes on in the tube. 1, 2. Okay. And then we're going to put the sterile sodium chloride solution into our donor. And fill it up to about 4 mils. Okay. Just going to gently mix that around. Alright, and then we're going to do the exact same thing for our recipient. Just going to take the plasma off the top. grab 2 drops of the washed erythrocytes into our recipient tube. 1, 2. Okay, so we have the recipient's blood, so I'm going to grab 2 drops of the erythrocytes and place them in the tube. Okay, and then put 4 mils of the sodium chloride into the tube. And I'm going to gently turn it. Okay, and then I'm going to put these in the centrifuge. Turn it to 1 minute, get blood, and hit go. Okay, so we've centrifuged the donor down. So what we're going to do is we're going to decant the supernatant off the erythrocytes. So. I'm going to fill it back up with our sterile sodium chloride, once again, up to 4 mils. Okay. I'm going to gently mix it one more time, and then do the same for our recipient. Fill it back up. Okay, we'll place it in the centrifuge again, another minute at 3,400 RPM. Okay, so we've centrifuged these 2 times. This is the last time we're going to do this. All right. And then fill this back up with 4 mils.
Yeah, no doubt. Sorry, if you're hungry.
And we're going to gently just mix it around. And then we're going to do the exact same for the recipient. once again, fill it up with 4 mils. Gently mix it, and then centrifuge it for a 3rd time. Okay, so we've centrifuged these for the 3rd time, so we're going to go ahead and decant supernatant and get our erythrocytes. And we have our 0.98 sodium chloride here. So we're going to go ahead and decant our supernatant. I'm going to be taking 0.02 and I'm going to be putting it in our tube. I'm going to be doing the exact same thing for the recipient. Same thing. Got the 0.98. I'm going to be drawing up 0.02. And placing it in our tube. Mix it gently. Okay, so now that we've got everything spun down, we're going to go ahead and start the testing process. So I'm going to go ahead and start with my major cross match, which I'm going to just take the top off. And I'm going to start with my recipient serum. I'm going to place 2 drops of that. Major cross match tube. Okay, and then my donor erythrocytes, I'm going to push 2 drops of that in the major cross match. Okay, and then I have my minor cross match. Take the top off of that. Go ahead and place the top of my major back. Start with my recipient erythrocytes. Place 2 drops. And then my donor serum. And place 2 drops as well. And then I'm going to be doing the control donor as well. So I'm going to be taking the donor erythrocytes. I'm going to be placing 2 drops. And then my donor serum. And then I'm going to be doing my recipient control as well. So the erythrocytes, and then the serum. And then we'll be back in 30 minutes whenever these have been gently shaken over 30-minute time. Okay, as you can see here, we went ahead and centrifuged our samples after them being incubated at room temperature for 30 minutes. And as you see here, it is actually fairly clear. The recipient control and the major cross-match, they're actually very clear, but the major cross-match, or the minor cross-match and the controlled donor are actually very cloudy and agglutinated. So they would not make a good match for transfusion. Okay, today we're going to be doing a skin scraping. This is Miss Smiley, and we're not really sure what is on her paws, but we're suspected ringworm. But we're going to go ahead and skin scrape. So I've got my mineral oil. I'm going to get a 10 blade. Scrape it up the sides so it won't be so sharp. I'm going to do my skin scraping. I'm going to get as much. It's okay. It's alright, Miss Smiley. I know. It's okay, honey.
It's okay, baby.
It's okay. It's okay. It's alright. Just need to get deep enough where we get a little bit of blood. And then for skin scrapings, it's important to get multiple places. So I'm going to switch her feet.
Hold on, Mikey. It's okay.
Looks like we've got a pretty good sample here. Okay. We're just going to take this, look under the microscope. Just going to get on the 4-power. And make sure that examine our field, make sure we don't have any friends down here.
Somewhere. Put it somewhere. Okay, I'll put it somewhere.
And I'm going to go to my 10-power to examine a little bit closer. And unfortunately, on this slide, we don't see any type of mites or anything like that. So now what we're going to have to do is pluck her hair and do a fungal culture.